Hi friends, good evening. I'm Dr. Ashutosh Gupta, and let us talk about the size of the fetal head, right? So what we've identified is this that this could be the size of the head of the fetus in utero. This could be a familial trait. This could be an autosomal dominant, है ना? It runs into families, meaning thereby whatever is the size and whatever is the shape of the head of the either of the parents of the father or the mother, so the fetus can also have the same sort of an shape and the circumference and the sizes of the head. This usually gets manifested in the late second and the early third trimester. So meaning thereby there's something around 32 weeks or so. So probably what we can identify is this, that there is some variations in the size as well as in the shape. And so we do have our own criterias by which we can identify, but those are not abnormal. So meaning thereby that they could be less, they could be more. And so if it falls at -2 SD, it is not a microcephaly. We can have a sloping forehead, or otherwise if the head is greater and reaches to +2 SD, and therefore it could be classified as a macrocrania, and we can have a sort of a frontal bossing. But all these things are a normal variations. So we do have two cases in which I'll make you see and understand that both these things are in familial, meaning benign, big, normal familial trait that runs into families, right? So मैं वो आपको दिखा देता हूँ. So 30 weeks पे देखिए, तो जो head parameters है, they are falling less. So this is the weight that we are trying to follow, and then if we see the head circumference, so this is at -2 SD. Then this would come as a biparietal diameter, which is also at -2 SD. Now we try to look around for the long bones. So this is the long bone. So this is at the middle line, which is at the 50th centile, and this is the another long bone, which is at the 50th centile. So what we're dealing up with this is the head. So architect of the head is absolutely great. Now we can see a sloping forehead, but this is a normal variant. This is not a microcephaly. Microcephaly नहीं है और ये normal variant ही है, right? This is the second case in which we can see on a biometric chart कि हेड सर्कमफ्रेंस के पैरामीटर सारे ज़्यादा हैं. तो इसको देखिए, तो ये एक लाइन से +2 SD की तरफ है ये, और ये भी हेड सर्कमफ्रेंस ऊपर है. एंड देन वी ट्राई टू लुक अराउंड फॉर द लॉन्ग बोन्स. वी आइडेंटिफाई कि वो बिल्कुल मिडल लाइन पे आ रहे हैं. ठीक है. So this is the frontal bossing that probably I was trying to tell you. Na? So this is an macrocrania. It is an autosomal dominant. This runs into families and absolutely normal thing to happen. So need not to get. We should not be worried about all these things, right? These are the normal variations. So in our understanding, we have got a long old dictum in which we say like mother like baby, like father like baby. So that holds true as far as the size and the shape of the head of the family members is concerned. Okay, so anything which is at -2 SD, so this is not classified as a microcephaly. This could be a normal variation. And if the head circumference is as +2 SD, then also it can be classified as a macrocrania, but this is also an autosomal dominant trait and is a normal variation. Now, how do we classify and how do you say when they are abnormal? Is this that we do have these two lines, which is at +2 SD, normal and -2 SD. Now we draw a line parallel to a -2 SD line, so that would be a -4 SD. So meaning thereby that whenever the head circumference that particular line breaches -2 SD and breaks to the -4 SD. So an imaginary line that we intend to draw parallel to a -2 SD line. So if it breaches -2 SD and reaches the third imaginary line that we have drawn, then it becomes microcephaly. And then that becomes sinister, and then that becomes abnormal, right? So we can have a lot of genetic variations, we can have environmental insults, we can have a Zika virus, and innumerous things to talk about. But until unless the head circumference lies at -2 SD or +2 SD, this is a normal thing, absolutely normal variation in the family. It runs into families. We have identified. I have got a lot of videos in which I have told that we can have some abnormal shapes, and which vis-a-vis which was there in the mother, and therefore we have identified that this is a normal trait to happen, right? Okay, so the head circumference at -2 SD and +2 SD has to be looked around into right clinical context. They are not abnormal per se, and we need to identify that there could be an autosomal dominant in transitive families, or either of the parents they can have some variations. They could have some issues regarding the sizes and the shapes of their head respective, right? So need not to get worried about all these things, right? Thank you very much for your patience.